It's Sharon. I wanted to post a video, around the surgery. So today is Saturday, August 1st, 2015. Yesterday was my birthday. Yay! And I had my surgery Wednesday, July 29th, 2015. So in the previous videos, I know I talked about how the surgery went and stuff. So I just wanted to give an update. As far as my progress, I said that I wanted to document my progress before and through and after gastric bypass surgery, and that includes everything, good, bad, ugly, and even fabulous things. So here I am. Surgery went well, went smoothly. There was no complications. Everything went as planned. They didn't find any hernias, or the scar tissue wasn't too bad in there. I'd had my gallbladder out previously, and I have endometriosis too, which can impact. They have to detach like your bowel and stuff, and apparently they didn't have difficulty with any of that. Surgery went super well. I want to talk a minute about the gas pains. That is brought up a lot. They're terrible. Terrible, terrible, terrible. I don't even know what to say. So the first night, I had a lot of pressure on my chest, like the night of the surgery. I was like, oh my God, I need pain medicine. I feel like I'm going to have a heart attack. I knew it was the gas. But I was so groggy from the anesthesia, and they were giving me, so I was on a PCA pump. So I could push the button whenever I had the pain, and it really helped with that. I found they were giving me Toradol through the IV too, which really seemed, I don't know what, it must have been taking down the inflammation or something, because it really seemed to help as well. So then the next morning, Next morning, I had to get up, and right away they do gastric, what do you call it? GI study. I'm sorry, somebody's texting me, a girl I met in the hospital, which I'm really excited about. Anyway, so you couldn't have anything that first night. You could only do mouth swabs. So the next day I was so thirsty, and I go down to radiology. It's because I have to drink this stuff. It's called gastrographin, and it's terrible. You don't have to drink very much, just enough that they can follow it and make sure that you don't have any leaks or anything. So I was so thirsty, and everybody was talking about how terrible it was. And it was pretty terrible, but I was so thirsty it didn't matter. I was like, put something in my mouth to, moisturize it. That's fine. So I did that test. It came back perfect. There were no leaks or anything. But as the day progressed, I literally was watching my stomach grow and bloat and bloat and bloat and bloat. So it's still so pretty bloated, like huge. I have this heating pad on it now because the discomfort is just so bad. They discontinued the PCA pump and moved me to PO medication by mouth, which I wasn't really taking because I didn't really feel I needed it, because it's hard to distinguish between whether you're having surgical pain or whether you're having gas pain, because the whole stomach hurts. I didn't get it in my shoulders. I got a very little bit in my back, but it's in my stomach. And other than the night before, the night of the surgery when it was in my chest, it's been in my stomach. So that's been really rough. The stomach pains have just been so terrible. As far as moving around, getting in and out of the bed, that hurts. It feels like described by other YouTubers, it feels like I've done 1 billion sit-ups and all my muscles are so sore, and like I hadn't exercised in a year, and all of a sudden one day I did 1 million sit-ups. That is kind of how it feels getting in and out of bed, which I can tolerate that. My incisions, there are 8 small incisions all over my abdomen. I asked why they'd done so many, and the surgeon didn't really give me an answer now that I'm thinking about it, unless I was just medicated when he did. and I missed it, sorry. But eight incisions. So they were all, they look great. They're healing fine. After I passed my upper GI study, again, pretty bad thunderstorm right now. After I passed my upper GI study, I was able to start drinking fluid. So I started with water, literally 2 ounces of water. Took me about 4 hours to get through. Then they sent up a broth. I tried the chicken broth. It was way too heavy. It felt like syrup trying to get it down. So I got half an ounce of that down. Later I tried the beef broth. It was a little bit easier. I got an ounce of that down. But it wasn't easy. Like an ounce or 2 ounces over like several hours. So I did that all day, and then yesterday, in order to be discharged, you have to successfully drink a protein shake. So in the morning, my stomach was hurting so bad, and I just did not want anything. Because when you have this happen, you kind of want to rest your gut. Like, that's what I feel it needs, rest. But they're like, drink, drink, drink. So, honestly, I would have preferred if they just kept the IV in until I get discharged to keep me hydrated, because pushing the fluid I don't think is the best thing in the whole world. You should listen to your body, and my body is saying no, let your gut rest. But so I tried to drink this protein shake, got about an ounce in, could not do it. It wasn't so much the taste of it, it was just the fact of drinking something, forcing something in your stomach. My stomach must be pretty swollen, which they talk about, that if it's swollen, it's harder to get stuff in. So, and the protein shakes are pretty thick, so it was tough. I did dilute it. I put it over ice, so then as the ice melted, it diluted somewhat, and that did not help at all. So I was supposed to be discharged at like 12. Watched the other people that had surgery the same day as me in the hospital get discharged. They're all going out the door here, there, but I couldn't get the stupid shake down, so I was there a lot longer. Then they brought up a vanilla shake. I tried chocolate in the morning, and I choked it down. Excuse me, that's a pain medicine. I choked it down and was able to get what I needed to down in order to get discharged. So I came home and was so happy to be home, like just so happy. You just heal so much faster when you're at home. And yesterday was my birthday, so I got home and I had flowers everywhere and balloons and streamers and cards and presents, and like my best friend had come over and brought a present and flowers and a card. My parents came by, so it was really, really nice welcome home for me. The rest of the night was pretty uneventful. I am taking the Oxy as needed, trying to reduce some of this pain so I could be more mobile. Did get up and walk quite a bit, and then I tried to drink my own shake, and they do say that you can develop some lactose intolerance. I love milk. I've always loved milk. I'm like one of the rare adults that craves a glass of milk and can drink a whole glass of milk. However, I could not drink this shake, and I've been drinking the shake with no problem before the surgery. I liked the taste. It went down easy, but it was tough. So I drank about 2 ounces of it over maybe a 2-hour period. And then I started to vomit. So that isn't good. That's what all these broken blood vessels all over my face are. It's all broken blood vessels from vomiting. I am the lucky Irish Italian girl that has super fair skin, and I don't know. This started a couple years ago. I don't know what the deal is, but if anybody out there knows how to stop your face from breaking out like this with broken blood vessels when you vomit, please send me your secret, because unfortunately I think there's going to be a lot of vomiting coming up, and I can't look like this all the time. So I just didn't even bother trying to take anything else last night. After I vomited, my stomach hurt so bad. So I ended up sleeping fairly well, and then this morning I got up and made an herbal tea. It took me all day. It was in 8 ounces. I measured out 8 ounces, the herbal tea. Kept warming it up throughout the day. I literally took me about 7 hours to drink it, and actually, yeah, I still have about an ounce left, so I didn't even finish it. I've not even attempted the protein shake today because I don't want it, and I don't want to throw up again, and like I said, I think my stomach just needs to rest. So I have the heating pad that I've been using on my stomach for a couple of reasons. One, to see if the warmth will help move this gas along. I'm not passing gas yet. I'm not belching. It's just there. And it also helps with the incisions. It makes them feel a little bit better. So that's that. What else? So as far as what to bring to the hospital, Melly May had mentioned an eye mask. I believe it was Melly May. So I have an eye mask that I use. I had it at home. It's the same kind that she used. It does look like a little mini bra. But it's got these like cups inside. I don't know if you can see them. Yeah, they're like little indents. Like craters. And so your eyes, so it's not pressing against your eyes, and it's really quite comfortable. Actually, it looks a little better than my broken blood vessels. Yeah. So that's my eye mask. Loved it. Loved it, loved it, loved it. Because all I wanted to do was sleep in the hospital. And seriously, every time I fell asleep, they knocked on the door. So I got to the point where I was just like, I put the eye mask on. I said to the nurse, please don't think I'm a weirdo. I have an eye mask. Put the eye mask on. I left my TV on with the music option. So there was a little light in the room so they wouldn't have to turn the light on. Had this on. And I slept, and they came in, and I put my arm out, like, do what you have to do. Give me my IV or take my blood pressure and blood sugar. And it helped a lot. So I highly recommend this. The other thing that I brought that I used a lot was my own pajamas. So I bought 2 nightgowns. I'm not a nightgown girl, and somebody had recommended in one of the YouTube videos to bring loose-fitting clothing or a nightgown or something that doesn't press against your stomach. So when she said that, I thought she meant because of the incisions, like they're sore. I don't know what she was referring to, but for me, I am so glad that I bought nightgowns because they're flowy, and even my underpants, the band on my underwear, pushing against my big, bloated, painful stomach is too much to bear. So I'm very happy that I don't have like pants on or anything. I could just wear the nightgown. So that was huge. So the first day of the surgery I did not change. The next day I changed to put my nightgown on, and I have a robe as well, which I used because you have to walk. So I would highly recommend bringing a robe. It feels kind of awkward. You're walking around the corridors of the hospital in your pajamas, and then there's these visitors there, and the staff and stuff all in normal clothes, and so I was happy I brought the robe. I did bring flip-flops. I brought slippers too, but my slippers are kind of hard to get on. I have to pull the back up with my finger, and I wouldn't have been able to do that because my stomach hurt so bad bending over. So I was glad that I had flip-flops with me because I just stuck them on, went for my walks, went to the bathroom, didn't have to fuss with the slippers, or you could wear their socks. They have those gripper socks, but I don't like the way those feel, so I brought my flip-flops. So that was really good. How am I doing today? So I had the surgery Wednesday, Thursday, Friday. Today is technically 3-day post-op, 4 days since the surgery, if you want to count the day of the surgery, 1. So 4 days. I'm doing okay. I am definitely having buyer's remorse, which they talk about. I just can't see the light at the end of the tunnel here. I can't. I'm in so much pain. I'm so uncomfortable. I am so bloated because of it, and I really feel like I am going to be the one person that does not lose a pound. Like, that's me. I won't lose any weight. I'll go through all this and still be fat. So, I am having a bit of buyer's remorse because of that. Like, am I going through all of this for nothing? However, I do want to talk a minute about my diabetes. So, I am diabetic. I've mentioned it before, and that was like my first goal. I wanted to be non-diabetic. I have been on insulin for years. I've been diabetic for 19 years. And the night of my surgery, my blood sugars were in the 140s. I had not had any kind of insulin the night before, since the night before the surgery. And each day, every time they checked my blood sugars, they were lower and lower and lower. Now they're hovering in the 70s and 80s. Granted, I'm not eating anything, and I'm drinking barely anything. Like, this herbal tea isn't going to really give me anything. And when I was in the hospital, they actually had to give me a regular popsicle. They mashed up my meds and put it in a regular sugar popsicle, which I have not had in like 20 years, to try to get my blood sugar up a little bit. So when I was discharged home, they took me completely off one of my insulins. They said, excuse me, that's the pain medicine. I'm so tired. I said to the surgeon, what is going on? My blood sugars are so low. And he said, I wanted to talk to you about that. Actually, your body is correcting itself. It's doing what we want it to do, what happens in a lot of patients. It goes through this correction stage, and you'll have some lows, but it's your body. You are technically in remission for diabetes. I can't even imagine that. Like, to have already hit my first goal so quickly and be off insulin. Like, I have not used insulin since Tuesday night. Not once. And I can't say for sure once I start eating that I won't need insulin. I'm hoping and praying that this just did it. Like, I'm done. But it seems too good to be true. I'm like the bad luck queen. So it doesn't seem possible for me for it to be that easy. But if it is, wonderful. I'm so happy. So that's kind of everything right now. Excuse me again. So sorry. Just trying to get through this week, Tomorrow I will attempt a protein shake and see how that goes. I'll probably mix it with water instead of milk. And I have to start taking the vitamins, which I haven't started taking them yet either. So that's about that, and until we see each other again, I will see you soon. Hope you're all doing well. Thanks.